My name is Eggert Stockfleth. I'm the head of the European Skin Cancer Foundation, and I'm working in Berlin for the University Hospital Charité. The European Skin Cancer Foundation was founded in 2008, and the aim of the European Skin Cancer Foundation was actually to increase awareness on skin cancer in Europe, to run education programs, to be open to everybody and to spread around the knowledge about how to prevent and how to treat skin cancer. Everybody can prevent skin cancer. So what we are always telling the people is that we are not against the sun. Even we tell them, go out into the sun, but you have to take at least a couple of rules on board how to behave in the sun. It means stay out of the sun between 11 and 3 o'clock, wear clothes, use a good sunscreen, use a good sunglass. The problem with the sun is that when you go too much into the sun, and let's say you have a fair skin type, the sun induces directly gene mutation in your skin. Normally you can repair this. If this is not possible or your immune system cannot repair that anymore, the tumor cell will go into broken cell death, what we call apoptosis. But over the time, over years and years, chronic UV exposure leads to a downregulation of the local immune response, and then you have the risk that you will get cancer. It's more or less an old, very well-known disease normally, but in the past we had problems really to understand that actinic keratosis is a very early stage of invasive cancer. And I always try to explain it to my patient. It's a little bit like a biological marker that your UV bank account is full. That means actinic keratosis or solar keratosis, it's a clear signal or sign that you receive too much sun during your life. And then most of the skin tumors which are related to UV light are increased, especially squamous cell cancer. When you have something on your skin which changes, let's say it does not go away by itself in between the next 3 months, it started to bleed or itching, you should be aware of skin cancer and you should go to a dermatologist. The big advantage of skin cancer, what I'm always telling my patients, is that you can see it. That's a big advantage. Look, if we would develop a liver cancer, you cannot see every day your liver, but your skin. You can watch your skin every day, so it's very easy. And when you recognize that something changed there and it does not go away by itself, you should consult a dermatologist. Currently, we are running a huge skin cancer screening program in Germany, where we involved 42 million German people. So what we did actually, since we cannot handle those 42 German people with just dermatologists, we educated GPs just to take care about changes on the skin. They don't have to make the diagnosis, but they have to recognize that something suspicious is there, and then they refer that patient to a dermatologist. I think this is very important. Also, let's say when you look to England has 62 million inhabitants, but only 350 derms. So you cannot really handle those 62 million people with 350 derms. So you have to, or you need special trained GPs, and they call them gypsies in England, for instance. So a GP plays a very important role. One of the biggest aim of the European Skin Cancer Foundation is to educate doctors. So what we are currently doing, we are inviting doctors to come to Berlin. We are educating them. We give them a slide kit in their local language. And then we educate them somehow as an ambassador of the European Skin Cancer Foundation to give 3 or 5 talks in between the next year in their countries. And this really helps us to spread around the knowledge on skin cancer in their country. So in Europe, you might know that most of the things are evidence-based medicine. That means the basic are the guidelines. It's in psoriasis. We do have a S3 guideline, which is the highest level of guidelines in Germany for psoriasis. We are currently working on and that's the first time, by the way, on a global AK S3 guideline, which is really a breakthrough. First of all, it's the first global guideline in dermatology in general, and it's an S3 on an S3 level. It means it's more or less like the Bible. So the aim of this S3 guideline is, of course, that the treatment, that the prevention against AK is globally everywhere the same. And this is raises the standard of treatment. So one, let's say, big advantage, in inverted commas, of actinic keratosis is it's very easy to detect, because sometimes I'm telling the patients, you can just feel it because it feels like sandpaper, and the whole area is involved. So it's not just a single mole or a single tumor which is located on sun-exposed skin area. It's a whole area which is chronic sun damage, and it feels like sandpaper. So therefore, to make the diagnosis that you might have an actinic keratosis, it's more or less very easy. But it's much easier for us to reach elderly patients. That's right. So, and the aim of the European Skin Cancer Foundation is exactly to support that, to bring derms and GPs, or let's say whoever have an interest on skin cancer. Even we are running kindergarten programs, so bring everybody on board who really wants to prevent skin cancer. The treatment, of course, should be in the hand of a dermatologist, but the early detection of skin cancer could be done also by a GP. The good thing is nobody will die because of an AK. So, and as I said, AK is a biological marker that your UV bank account is full and that you have a higher risk to develop invasive cancer. So AK is a very, very early stage, and you can treat that very successfully. Non-invasive treatment approaches. We have a lot of new non-invasive treatment approaches where you just put a cream or a gel on top of the surface and you get rid of your AKs. But not totally. That means if your UV bank account is full, you have more or less a chronic disease. So you have to retreat those patients. But when you are doing that, and when you use sunscreen on a regular basis, most of the patients will never develop invasive cancer.